Now talking about the test in orthopedics, I'll be looking at the concept of a Thomas test. And this Thomas test is done for what? The hip. You get, like, if there's a flexion deformity in the hip, you might want to do this what? Thomas test, just to detect it, right? So mostly the images will speak, right? This is flexion of the knee, right? Flexion of the knee, right? So normally if you lie on a flat place, if you flex one knee, all right, your other leg should remain flat. Do you understand? But when you flex this knee and your other leg is standing up just to support it, that's when you say the Thomas test is positive. I don't know if you understand. All right. So we're talking about this Thomas test from the definition, the procedure, interpretation of results. It's either positive or negative. The associated conditions, like what conditions can you use the Thomas test to diagnose? All right. So from the definition, we said that the Thomas test is a physical examination test and is used to assess for fixed flexion deformity of the hip. This is also known as what? Hip flexion contracture or Psoas syndrome. Coming. Um, coming. All right. Okay, so you are trying to see if there is what any of these abnormalities there, right? So what is a procedure? Is either you are doing it by yourself or a healthcare provider is helping you. Do you understand? So starting position, the patient actually lie on their back, just like this, supine position on an examination table. All right. Initial step, the patient will now bring one knee up to the level of the chest. You get, holding it with both hands. Don't leave your hands down and bring your knee by itself. You hold that knee and your other leg is supposed to be flat. If your other leg is up, then that means it is positive. Do you understand? The pelvic position, the examiner places one hand behind the patient's spine just to ensure the pelvis remains in neutral position. That's when the examiner is helping you. Okay. Then flexing the unaffected hip. The examiner flexes the unaffected hip until the thigh just touches the abdomen. All right. Which helps to what? Eliminate any lumbar lordosis. All right. That's excessive inward curvature of the what? Lower spine. Okay. Then passive hip extension. The examiner then what? Passively extends the affected hip while keeping the pelvis stabilized. So the examiner stops the extension once the pelvis begins to tilt anteriorly. This was big English, but I've already summarized what the Thomas test is, right? So, interpreting the result that what bottom leg can get to the table is negative for shortened hip flexors, right? Okay, so bottom leg can get to the table. Okay, it's positive. What are they actually saying? Well, you guys already know the negative and the positive. If your leg is still touching the table, it's negative. If your hand is leaving if your leg is leaving the table, it is actually positive. You understand? So you see it, right? This one is negative. If his leg was leaving this place up, it would have been positive, right? So what is the interpretation? For the positive results, we say that if the affected leg cannot fully extend, that means it remains in a what? Flex position. All right. It indicates a fixed flexion deformity of the hip or tightness in the iliopsoas muscle. All right. The contralateral leg movement, if the opposite leg raises above the table during the test, it suggests a fixed flexion deformity in the contralateral leg. Okay. What are the conditions associated with this? If there's a hip flexion contracture, right? This is a condition where the hip remains in a partially flexed position even when the leg is supposed to be fully extended. All right. The Psoas syndrome. This is basically what? Injury or tightness in the psoas muscle, often seen in athletes like what? Runners, dancers, and gymnasts. Okay. So guys, that's it for the Thomas test, which is done for what? Flexion deformity of the hip and yeah, flexion deformity of the hip though. Yeah, and even psoas syndrome. Okay. So that's it, guys, and bye for now.